Let's go to a Melbourne politician, also a medico now, Dr. Katie Allen, who's the federal member for Higgins. Good to talk to you, Katie.
Good afternoon, Chris.
First up on the ad, is it wise to portray a 30-ish woman as being a COVID victim, especially when such small numbers of people, healthy young adults, are likely to get that seriously ill? And secondly, when your own vaccine rollout doesn't target them for that very reason?
Look, I do think that we've got to make this connection, that the next phase of this pandemic is basically we're backing in the vaccine. And the way to do that is to get people's attention and to realise that COVID can affect anybody. It can affect young, old, and it can result in death. And what the point of the vaccination program is turning this disease from possibly a deadly disease for you and your family to something that is more likely to just be a serious infection. And so that is the point of the COVID vaccine rollout. It's about preventing death. And we need to make the link that in order for us to all be able to get back to what we were doing, we need to actually fight this virus with a great vaccine rollout. Now, it is true there's been issues of supply overseas. We've had, in some ways, a luxury of being able to wait and see what happens overseas while we wait for our supply to come. And we do know that overseas they've needed that supply. Companies have put their citizens before their market or their consumers overseas, and that's understandable. But if you look at the vaccine rollouts that are happening in countries where they've had daily death tolls, it's not surprising that people are putting their arm forward. So the New South Wales lockdown is reminding people that this is a real and present threat, and there are things that we can do in the here and now, and that includes getting vaccinated.
Well, I'll get onto the vaccine in a moment. When it comes to those communications, though, the real fear for healthy young adults is that they will be carriers for the disease, that they'll get infected and pass it on to their parents, to their grandparents and others. I would have thought that's what all the data and all the experts have told us for so long now. But let's leave the ad campaign alone then and talk about what it's directed at, and that is, as you said, the vaccination program. Are you concerned that the fears of ASTRAZENECA, and I recognise there was a 72-year-old woman announced today that was her death was attributed to the vaccine, have those fears been overstated? Because what the authorities have done have balanced up not just your chances of surviving if you have the virus versus the vaccine, they've calculated also your chances of getting the virus in the first place, which in this country, up until a month or so ago, was virtually zero.
Yes, and I think that's if you look at the Intagi advice, on the left-hand side, they talk about the impact of potentially having clots associated with the vaccine, and on the right, they've put down whether you're likely to be hospitalised or whether you're meant to be likely to go to the ICU or are likely to die from COVID. And I actually have asked that they look at both, apples for apples. What's the risk of death from having the vaccine versus the risk of death from getting COVID?
Absolutely.
And that risk balance is changing. We're lucky that we haven't been reporting deaths because there aren't any with regards to COVID, and therefore we're not looking at, risk of death from COVID versus risk of death from COVID vaccine because we don't have any deaths from COVID. Well, we've had one unfortunate death this year. And in the UK, they're continuing to have a daily death rate. In fact, a couple of weeks ago was the first time since the start of the pandemic that the UK had a COVID death-free day. It was the first time since the start of the COVID pandemic there hadn't been a death from COVID.
Yet now, we have 5 million people in Sydney locked down. This is overreach, isn't it?
Well, I believe that I back in that Gladys is going through hopefully what's going to be a short, sharp lockdown, but she wants to get control of this new Delta variant.
It's already been 3 weeks.
Well, she wants to get control of the Delta variant. We are still in the transition. We're still rolling out the COVID vaccine. We have had supply issues. We've had side effects concerns. We've got to get the community on board. I think that we are going to get to the other side of this. It has been, messy, and we knew it would be. We're talking about a new disease, we're talking about a new vaccine, and we're talking about the community working out the risk-balance ratio for itself in an environment which is a long way from where most of the problem has been. So, we're a bit more tentative about that risk-balance ratio because we can be more tentative about it. But as we go forward, and every time we see something like Sydney happen, people go, right, we better roll up our own and get our vaccine. That's luckily one of the good side effects of what is a very terrible situation for Sydney, and I do understand how frustrating it is for Sydney. But we know that the lockdown will get control of the COVID outbreak. We know the vaccine ramp up is happening as we speak. We know we'll get to the other side of this, and it is one of those things where we all need to work together to get to the other side.
Thanks for joining us, Katie. I appreciate it.
Thanks so much, Chris.
Dr. Katie Allen there. Yeah, we just got to do this without lockdowns. We can't keep locking down when most of the people who are vulnerable are vaccinated.